We all know mammograms help save boobs, but do we all know who needs a mammogram? Or where to get a mammogram? Then once we figure out that, yes, I do need a mammogram, what if I don't have insurance? Or even with insurance, it's still really expensive. That's why we created My Mammo Matters. It is based on a widget that helps people find access to HIV screenings, and basically does the same thing. It connects people to their closest clinic and assesses their eligibility for all the local programs that may help them pay for the mammogram. Why is this important? Special? The reason this widget is important is because the programs that would be originally incorporated into the widget are the programs that currently support women at or below the 250% federal poverty level in Colorado. This is significant because research has shown that disparities still persist among racial ethnic minorities and low-income women, and that low-income women have the lowest rates of breast cancer screening. Currently, these programs rely on the funded healthcare agencies to spread the word about getting women in for their mammograms. But do you know who also is really effective in spreading the word about these great programs available? You! Women who have gone through and received financial help for a mammogram, or learned they need to get a mammogram, are our biggest advocates in spreading the word to others, especially those who have helped find breast cancer early. If we can remove the need of relying on a public health professional to spread the word to another person they physically encounter, we may be able to spread the program to areas that have not yet been reached. By allowing people to post the widget on their own personal websites, blogs, and social media pages, we are increasing the spread of the program with mHealth, which has the potential to reach many more people than could be served in traditional programs. That's why we're making it easy for women to share how to get a mammogram. As I mentioned before, My Mammo Matters is based off an existing widget that was created for the HIV community. The widget was formed in response to knowing that people are online and looking for health information. AIDS.gov and similar widgets that connect to resources are available on various well-known websites, such as the Center for Disease Control, and is in the top responses when a user Googles HIV testing. It has a simple source code that can be copied and pasted easily onto people's social media pages or shared by a click of a button. However, when inquired with a similar search on Google, Find Mammogram Locations, no such widget emerges that makes it easy for a client to go to one page to find multiple resources. In this Phase 1 evaluation, we want to design a widget with a simple source code that allows people to easily share it with their networks. Invite people to embed the code and share. We would target particular risk groups and promote the widget through social networks. For example, African American women have a higher mortality rate of breast cancer due to diagnosis later than non-Hispanic whites and are also high users of Twitter. We would track the number of shares and users by following the hashtag #MyMammoMatters, as well as include a question on intake forms to determine if more people are coming in due to the widget. The intake forms would also include demographic information such as age, race, ethnicity, income, and zip code, so we are able to determine if it works in one population or subgroup better than others. Facebook allows ads for as low as $10 a day, and we could utilize organizations with the funds to also help spread the word by embedding the widget on their social media pages. Google Analytics is a free program that could aid us in tracking where and how that widget is being spread, how many times it has been shared, and how many times it's been downloaded. Keeping scale in mind, we can then prepare for a larger trial to examine whether people are getting screened after exposure to the widget. If we could show that the use of the widget helps increase access in parts of Metro Denver, it has potential to increase access in other parts of the country as well. My Mammo Matters is a low-cost option to see if this is an effective way to inform people of their eligibility and to increase their awareness of breast cancer screenings. Share your thoughts now. My Mammo Matters.